Okay. I'd like to call the House Health Subcommittee to order. Would the clerk please open the board so we can take the roll? All right, clerk, please take the roll. Oh, you can't.
Mr. Chairman, you have 5 members present. You have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders for today? All right, seeing none, I will take a little bit of a personal order here. I'm a bit disjointed here because normally this committee is chaired by Chairman Martin, and he and his wife, Kristen, they had a baby boy the other day, and so baby Stockton, and so he is with his family. And then, like I said, I'm a bit disjointed. I could not have been here, but my son defended his dissertation at Vanderbilt today, and so he got through that and did well, and so I came in on 2 wheels, so I'm a bit disjointed as we do this, so you're gonna have to forgive me, some folks, with that. So we'll get to our calendar today. Item, let's see, House Bill 1286. What number is that? 11 is taken off notice. And item number 16, House Bill 2315, has been taken off notice. And we will go out of order and bring up House Bill item number 14, House Bill 2557 by Leader Lamberth. You're recognized.
Thank you, Mr. Chairman, members of the committee.
Need a motion? Second. You're recognized.
Thank you, Mr. Chairman, members of the committee. So our president, Donald J. Trump, has made a bold move to try to help and expand healthcare into our rural areas. And Mr. Chairman, I know that's something you're very passionate about. I am as well. The governor seized the mantle on that and has charged forward with several bills that would expand scope. I know that this committee has debated for years on how much is enough for someone to be able to provide in healthcare. to their community and what can they do that is at the very top of their educational attainment? What have they been trained for that they're safe to provide that healthcare and healthcare coverage? Our pharmacists do tests every day. And in fact, we went through this in my family not long ago, where we thought my little girl had, a flu. We didn't know if it's flu A, flu B. We didn't know if it's COVID. We didn't know what it was. And I went and got a test at the local pharmacy, and she tested positive for flu B. I know she wouldn't mind me sharing that. But what I couldn't do is I couldn't get Tamiflu. I couldn't get a prescription without, leaving there and going over to a doctor or a nurse or somebody else that could prescribe Tamiflu. Now, it was sitting right there on the shelf. It would have been pretty easy for me to, in the same store, to be able to go get that. I know we've debated these bills for years. I genuinely wish we would pass this bill this year and allow our pharmacists to operate at the extent of their training. But Mr. Chairman, I understand where the votes are on this particular measure today. Out of respect for you and this committee, I'm not asking them to move forward. I'm going to take this bill off notice, but I would like us to please consider what the president, what the governor who's outgoing, and what I hope the next governor will do as she assumes office. I hope that we look at very carefully and closely how we provide health care to our rural areas and all of our communities. And Mr. Chairman, I know you do that to a very, very high degree in what you do every day as a job. And we deeply appreciate that. So I understand that the vote will be just about locked in this committee today. And again, I respect y'all. I'm going to take this off notice. But I did just want to say, if not this year, when? Because our pharmacists are ready, willing, and able to do more than we allow them by law to do now. And I feel like they can safely do so. So, Mr. Chairman, I've said my piece, and I would ask to be taken off notice.
All right. Thank you. House Bill 2557 is off notice.
Thank you, Mr. Chairman.
Thank you. All right. I'm going to go out of order again and bring up item number 17, House Bill 2278. You have a motion, a second.
Thank you, Mr. Chair. Committee, certainly be good to be with y'all today. Hope everybody's well and in a good mood, since you didn't have to vote on that one. Vote yes on this one. Mr. Chair, Committee, years ago in East Tennessee, we saw a trend that some of our rural hospitals were potentially going to be closing. That was before a trend of that happening. Yes, sir.
Do we have an amendment?
We
need to
do.
adopt?
Thank you. Should have thought about that.
We're going to have to work together on this. Like I said, I'm disjointed. Okay, what's our, what number do you have here?
I have 015525.
That's what I've got here, 015525. All in favor, say aye. Opposed, ayes have it. Now we're on the bill as amended. You're recognized.
Mr. Chair, there's two amendments to.
Okay.
One's not mine, but I'm not sure how you want to run that
Okay.
one.
Do you want? Okay. Representative Hill, you're recognized.
Thank you, Mr. Chairman. And I wanted to just speak very, very quickly. I've got an amendment to this legislation on behalf of the delegation and certainly on behalf of my district. I want to say thank you to all the stakeholders, including Chairman Faison, for working with me on it. It will be ready to go once we get to full. The legislation has my support. We want to get the amendment dialed in and right before we add it to the legislation, with the intent of dealing with, and I don't want to steal any thunder from Chairman Faison in his explanation of the bill, but bringing parity to acute care certificate of need with the dissolving of the COPA. And that is what we're working on, and fully intend to add that in once we get into full in collaboration with all the stakeholders. So with that, Mr. Chairman, I'd withdraw my amendment.
All right. Thank you. All right. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chair. So committee, just kind of give a little brief history. In Upper East Tennessee, we saw the writing on the wall that we were going to potentially lose some of our rural hospitals. The Medicaid reimbursement program for us in Tennessee is not good, especially in the 1st Congressional District. It's not okay. So the legislature, local government, and the federal government worked together to come up with a thing called a COPA. That means Certificate of Public Advantage. It truly is the mother of all CONs. As the legislature moves forward with other CON bills, we feel like it's important to keep parity with the ballot health system as how it operates in Upper East Tennessee. And this bill would dissolve the ballot health COPA, if you will. with a lot of requirements, including the Attorney General, to be able to oversee and make sure nothing is going wrong with how they operate. Mr. Chair, that's basically what the bill does.
All right. Do we have any questions? Representative Hicks, you recognize.
Thank you. And not necessarily a question, but just I want to sort of few comments. And next week we'll truly be in support of Chairman Hill's amendment. But for years we have operated under a system of healthcare that was put in place with the goal of improving coordination, stabilizing services, and delivering better care for patients. But over time, we've seen that when competition is limited, accountability can weaken, and patients can feel that through higher cost and fewer choices. This legislation makes needed corrections. It sets a clear date of 2028 for the current COPA structure and the special treatment that comes with it. That's an important step towards restoring more competitive, patient-focused healthcare system. Now, we can do this the right way. We don't create instability. We don't leave families exposed. Pricing safeguards remain in place temporarily under the Attorney General, where it should be, to ensure that there are no sudden spikes while markets adjust and newer providers enters the market. That's responsibility. That's balance. We also make it clear that state and federal antitrust laws remain fully enforced. If anyone tries to take advantage of their position, there will be consequences. This is about getting back to the fundamentals: more competition, more accountability, and better outcomes for patients, because that's really what it's truly all about. We're moving away from a system that concentrates control and toward one that puts patients first. So thank you, Mr. Chairman, and I appreciate this legislation. We truly need it in Northeast Tennessee.
All right. Thank you. Representative Gant, you're recognized.
Mr. Chairman, I know I'm out of order, but we have some special guests with us here today. The Tennessee Charitable Care Network Day on the Hill is today, and they are here with us in committee. If y'all would make them welcome.
Chairman Williams, you're recognized.
Thank you. Chairman Faison, just want to thank you for this bill. There was an attempt to try to fix this issue on another bill that caption didn't hold. As somebody who grew up in Upper East Tennessee, was born and raised in Upper East Tennessee, the challenges and the changes that occurred from establishing this in 2014, I believe it was, have been extremely detrimental to the local community there, particularly with public or with providers there. And you've seen the services completely change in such a short period of time, because the decision that this body made back to implement this, we thought at the time was good. And I think it's important for us to look back and also as members who have been around a couple minutes, and you and I came in together, some of the decisions we made, we think they're good at the time that we make them, but the opportunity to right those wrongs is exactly what this bill does. And hopefully with this release in 2028, we'll be able to see the establishment of healthy competition, as well as increase the quality of the services of healthcare services that are being provided to these citizens up in Upper East Tennessee. And so I want to thank you for the bill. Thank you for you sponsoring it, and for that Upper East Tennessee delegation that in the last 5 or 6 years have done nothing but advocate for change up there. This is very important to them. As somebody who was from there, I know that. And so just want to thank you for carrying this bill and the work you're doing there.
All right. Any further questions for comments for the sponsor? All right, seeing none, let's open up the board for a vote. All those in favor vote aye. Opposed, vote no. Clerk, please take the vote.
Mr. Chairman, you have 8 ayes and 0 noes.
All right, House Bill 2278 passes and goes on to full health. You're recognized.
Mr. Chair, I have signed on to item number 152558. Can I roll that to the Hill?
Yes.
Thank you.
All right. To the Hill. All right, let's go back to item number 1, House Bill 2258 by Chair, 2259. Chairlady Hilton Haynes, you're recognized. You have a motion and a second. And do we have an amendment?
Yes, Mr. Chairman, we do. It is drafting code 15993, and it rewrites and makes the bill.
Okay, drafting code 15993. We have a motion and a second. All those in favor say aye. Aye. Opposed? Ayes have it. But you are recognized.
Thank you, Mr. Chairman. House Bill 2259 as amended clarifies that good faith disclosures to patients or regulators do not waive quality improvement committee privilege. It establishes that a good faith disclosure of information related to an activity of a quality improvement committee are considered separate and apart from QIC proceedings. It exempts healthcare providers and organizations from disclosing findings, determinations, or conclusions of a QIC during a legal, administrative, or other proceeding unless provided by state or federal law. Specifies that a healthcare provider or organization may engage in open communications with a patient or their family, but that communication is not an admission of liability and are protected from discovery or other proceedings, and that the outcomes from the QIC review must remain confidential and privileged unless otherwise provided by law. It affirms that hospitals are not required to disclose QIC findings while creating a safe harbor for voluntary post-adverse healthcare incident communications with patients and families. Finally, it strengthens consistency and predictability under Tennessee's existing QIC statute. And with that, I stand for questions, and I think we do have someone here from THA if you have any technical questions.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, will the clerk please open the vote on this quick bill? All right, clerk, please take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
All right, House Bill 2259 passes and moves on to full health.
Thank you, Mr. Chairman and committee.
All right, thank you. All right, that brings us to item number 2, House Bill 2398. Representative Stinnett, you are recognized.
Thank you, Chairman. HB 2398 is pretty simple. In Tennessee, you have to be 18 years of age.
But let's get your amendment on there.
Oh,
Which,
I'm sorry.
uh,
13507.
Okay. Okay, you have a motion, a second. It is, okay, 13507. Okay, all those in favor vote aye. Opposed? Ayes have it. Okay, now we're on the bills amended. You're recognized.
Thank you, Chairman. Sorry. In Tennessee, you have to be 18 years of age to be in a child care center. All I'm asking to do is to change that to 16 years of age so we can, students in high school, we can put work-based learning students into child care units. I stand for questions.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, will the clerk please open the vote? All those in favor of House Bill 2398 vote aye. Those opposed vote no. All right, clerk, can you please take the vote?
Mr. Chairman, you have 7 ayes and 0 nays.
All right, House Bill 2398 passes and moves on to full health.
Chairman, thank you.
All right, thank you. Okay, we have item number 3, 2460. Okay, without objection, we'll roll to the heel. Item number 4, House Bill 2193. Representative Hale, there he is. You have a motion and a second, and I see no amendments, so you are recognized.
Thank you, Chairman and committee. House Bill 2193 is a bill that would give the decision-making authority on whether or not the state would participate in the summer EBT program to the General Assembly. Currently, the governor and commissioner of DHS have the discretion to participate in this program, and this would remove that power to the General Assembly. This does not enroll the state in the system. It just says that it would be, the decision would be made by the General Assembly. And the reason for this past couple of years, the governor has made the decision to only allow 15 of 95 counties to have summer EBT, taking 18,000 kids versus 700,000 kids across the state. That would have allowed us to pull down $90 million in federal funds. That would have been a big help to the economy of the state of Tennessee, but then also that we would have took care, I think we'd kind of all agree, when we got directors of schools that talk about the reason they leave, they hate closing schools for inclement weather is because they know there's going to be kids for extended days that's not going to be able to have food. So, but with that, and understanding the make of the committee and kind of as our leader said, knowing the votes, I'm going to move to take this bill off notice.
All right, thank you. And I appreciate you doing that, but I appreciate your work on the other bill that helps address this. And so
Yes.
we are addressing it, but
Right.
thank you so much. Okay, so without objection, House Bill 2193 is off notice.
Thank you.
Right, that brings us to item number 5, House Bill 1917. Representative Freeman, you're recognized. You have a motion and a second. And
Thank you.
we have an amendment, I believe,
We do. Drafting code 14334.
14334. You have a motion and a second. All those in favor vote aye. Opposed? Ayes have it. We're on the bill as amended. You are recognized.
Yeah, so this amendment updates the Tennessee counseling licensures by clearly distinguishing between limited practice professional counselors and licensed professional counselors. And with that, I stand ready for any questions.
All right. Any questions for the sponsor of the bill? Nope. All right, will clerk please open the board for the vote? All those in favor vote aye. Opposed vote no. And clerk please take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
All right, House Bill 1917 passes and moves on to full health.
Thank you, Chairman and Committee.
All right, that brings us to item number 6, House Bill 2404. Representative Scarborough, you are recognized. You have a motion and a second, and you have an amendment, I believe.
013828.
013828, that's what I have. Okay, you have a motion and a second. All those in favor vote aye. Opposed, ayes have it. In proper form, you are recognized.
Thank you, Mr. Chairman. This simply states that one of the persons appointed to the Medical Cannabis Commission by the Speaker of the Senate must be a specialist in the area of substance abuse prevention. And with that pretty much sums up my bill.
All right. Okay. All right. Seeing no questions here, will clerk please open the vote. All those in favor vote aye. Opposed vote no. All right, the clerk please take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
All right, House Bill 2404 passes and moves on to full health.
Thank you, Mr. Chair. Thank you, Committee.
All right. What number are we on here? Okay, I do not see him in the room. Okay, without objection, we will roll item number 7684 to the heel. Okay, that brings us to item number 8, House Bill 1160. Representative Lynn, you're recognized. Do we have a second? Okay.
Thank
All right,
you.
motion second. You are recognized.
Holding my breath. Thank you very much.
And,
And I have an amendment, Mr. Chairman,
okay,
016526.
016526. Is that what we have? Yeah. Okay. Okay, yeah, I need a motion second. Okay, motion second. Okay, all those in favor vote aye. Aye. Opposed? Ayes have it. We are on the bill as amended.
Thank you, Mr. Chairman. This is the same bill that we heard last week, only the amendment makes some changes that takes into consideration some of the comments that we had, very good comments that have helped improve the bill. So the major changes to the bill are that the adverse event reporting section has been removed. The informed consent section has been streamlined and tightened to make compliance as easy as possible while still informing the payment. The new amendment still excludes inpatient hospital settings. It also includes surgeries and emergency situations. All documentation and signatures required can be done in print or through any secure electronic means, such as the patient portal. Current prescriptions are exempted, so basically it would apply to new prescriptions, switching doctors, or if the FDA adds a new warning about the medication, the patient would need to be informed of any new warning. The product documents required to be provided to the patient are the FDA required patient medication guide, the highlight page of the product label, and a statement to the patient should a situation of polypharmacy exist. If they're on more than one medication that will have interaction with the medication being prescribed, they should be informed of the polypharmacy risk to them. And as discussed last week, this bill has to do with psychotropic drugs because they pose serious risks that can include suicide, violent behavior, cardiac events. And for children, it's even worse. That can include aggression and seizures and stunted growth and permanent changes to their developing brain. So this bill, what it will do is make sure that all Tennesseans, upon their first prescription, have information about these drugs, and not just if you're in a psychiatric hospital. I've heard some feedback from Senator Williams. Senator Williams, thank you. Chairman Williams. And
Don't demote him.
And I have someone here to speak to the bill, which may help understand whether or not we should amend it more. I think I hope everyone agrees that it's a worthy bill. Patients do need this information, and we have streamlined it a lot. But if the committee would indulge us and have our guest speak, and maybe Chairman Williams can ask some questions.
Okay. If there's no objection, we actually have some people signed up, so we will go out of session. I have Brittany Ruiz and a Bernadette Pager, and then we will have Dr. Michelle Cochran in just a second. But if you guys, for the record, can speak into the microphone, tell us who you are, who you're with, and then give us 3 minutes.
Okay, thank you so much for your time today. So I'm Bernadette Pager. I'm the volunteer Tennessee director of Stand for Health Freedom, but I'm also the private citizen who brought this bill to Susan Lynn. This is an issue that's very near and dear to our hearts. I have been speaking with a lot of people this week, over the weekend, last week, and even today I met with a senator regarding the bill. And I did want to let you know that our goal really is to make this so that the aspect of informed consent really happens. Right now, the full risks, through all the studies and the surveys done, full risks are not being conveyed. And really, this is all that it's about. We don't intend to stop any prescriptions. We just want to make sure that individuals who do choose these drugs and choose them for their children have the information they need so that they can then recognize adverse events when they happen. But I and Representative Lynn are fully willing to make any more adjustments if any of you have some concerns. So I am hoping that today that this body can move the bill out of subcommittee. And again, with that knowledge that we're open to making any minor changes that might be necessary. We really feel that providing this information is not a barrier to care. It is the ethics of care. And for FDA's drugs that carry the most serious warnings, potentially life-altering and life-threatening, we do believe that once it gets established and rolled into the protocol of prescribers' way of prescribing these drugs, that it's going to build trust between patients and doctors because they'll know that they are fully informed. And if something happens, they can go back to their doctor and they will have recognized those adverse events. So I thank you and I request your vote. Please help us move this out of committee. And if you have any concerns afterward, I'm very happy to meet with you and address those. Thank you.
Thank you. Ms. Ruiz, you're recognized.
Thank you, Chairman. Hi, Chairman and members of the committee. My name is Brittany Ruiz. I'm a volunteer director of policy for CCHR Tennessee. I'm a citizen advocate, and I've been in the realm of mental health care policy and foster care reform for over a decade. Last year, the Tennessee Department of Health released updated statistics which showed youth suicides in Tennessee increased from 2019 to 2023 by 47%. Tennessee's own drug utilization review surveys reports show a corresponding increase in psychotropic drug prescriptions across every age group, adults, children, and infants. That connection demands our attention. Today, 1 in 12 children and 1 in 4 adults are on psychotropic medications through TennCare. Drugs that, per the FDA's own clinical trials, double the risk of suicide thinking and increase aggression and hostility by 130% in children and young adults. A peer-reviewed study found suicide attempts are 250% higher in patients on antidepressants versus placebo. A separate study found that 70% of patients on psychotropic medications were told nothing about side effects, and fewer than 2% were told about the risk of suicidality. Patients are simply not being informed. HB 1160 simply requires that providers give patients the FDA product labeling and have them sign an acknowledgement. This legislature has already passed meaningful informed consent requirements for opioids, as well as subsequently for isotretinoin, Accutane. We are simply asking you to apply the same standard here. Psychotropic medications carry the same class of warnings and documented risks. Families deserve the same protection. Tennessee's rising prescription rates and the documented increase in youth suicides, aggression, and hostility make the passage of this bill an urgent necessity. I urge a yes vote, and thank you for the opportunity to testify, and I'm available if anybody has any questions. Thank you so much.
All right. Thank you for your testimony. And do we have any questions while they're here? All right. Thank you. And we will bring up Dr. Michelle Cochran. And for the record, give us your name, who you're with, and you'll have 3 minutes.
So, hello, I'm Dr. Michelle Cochran. I'm a psychiatrist in the Nashville area. I am the president and chief medical officer for a company called Synaptic Psych, which has 5 locations in the Middle Tennessee area, 4 in the Middle Tennessee area and 1 in Memphis. We have physician-led groups. I want to start my testimony by saying I'm here as an individual, as a partner in my practice, and also as a Tennessee physician representing the TPA, which I'm the current president of, and the TMA, which I'm a member of, and I'm representing the Collaborative Care Coalition, which is a large group of medical societies in the state of Tennessee. So I want to start by acknowledging what the testimony I've heard over the last 2 weeks, because I've been president during both health committees. And I was heartbroken to hear that someone, died and they felt it was a result of a medication. I'm heartbroken to hear that people think that they've developed suicidal ideation from medication, which can happen. It's in boxed warnings on certain medications. There are other boxed warnings which are similar in medicines like asthma medications like Singulair, antidepressants, antihypertensives, lots of medicines that are prescribed because box warnings come from those things that happen during a study when drugs are being studied. So warnings that are in package inserts, which some of the physicians that are on the panel will know, include things like the flu that might happen because a patient was exposed during a study. Doctors, when they do evaluations for patients, get a complete, thorough history, and they do an informed consent before they're seen in the office, there's an implied consent to get treatment by a patient coming in, but most doctors' offices, including ours, get a written consent for treatment. We do not currently get a written consent for medications that we prescribe, particularly in psychiatry, because many times we are giving multiple medications because that is the standard of care as dictated by lots of large organizations that have studied these things. So these come from expert consensuses because that's the best we have, because these studies are very expensive to run. Polypharmacy in medicine in general is very common. Diabetic patients, patients with high blood pressure. If any of you are on medicines, you have chronic conditions, you know that this is common. We have deep concern that there are serious flaws in this bill which make it completely unworkable for an office. And I worry what's going to happen is that 2/3 of psychotropic medications that are prescribed by pediatricians, primary care doctors, and OBGYNs are going to stop because they're going to see this too difficult. And then we are going to have a serious mental health access problem. So just because something happens after something is prescribed doesn't mean that that was the cause, right? That's an association.
Ma'am, okay, your time
Yep.
is up, but
Sorry about that.
do we have questions? I do have one comment. Can you tell us some of the barriers that you think?
Yeah.
Right.
So I see a big barrier with trying to navigate this with telehealth, which is a common thing in the mental health treatments, right? So there are many offices that may have telehealth capabilities, but may not have an EMR. So accessing a portal and getting somebody to sign something is going to be really hard. And that could cause a delay of care because they're going to have to mail out a consent. They're going to have to get that back in and make that work. The other thing I think is a big problem is we've got this description of the FDA cleared rules. I don't know if that's the package insert or if that's the 2 to 10 page paper that is a shortened form. And is that going to be sufficient for all the things? Is this something Tennessee should develop its own form and have a website where docs can download it and give it to a patient? The other barrier is this kind of already happens. We talk about all the big things. I've heard testimony of situations where it didn't happen. I think that's the exception, not the rule. I would love to read the paper the last person noted because I've never seen that paper. So I would love to see if that actually came out of a peer-reviewed critical journal. So,
All right, thank you. Any further questions? Representative Hicks, you recognize.
Thank you, Mr. Chairman. Do you, are people prescribed psychotropic drugs through telehealth?
Not in our practice because we see most of our patients live, but there are many providers that offer telehealth services in our state. And so, yes, a lot of those medicines are prescribed. In fact, most medicines are likely prescribed during telehealth, I would suspect, in our state. So.
You recognize.
Thank you, Mr. Chairman. What about our children? Are they prescribed these type of drugs through telehealth and no actual visit to a?
So given that we have, about 200 child and adolescent psychiatrists in the state, most of those folks see people live. In fact, in our office, our child and adolescent psychiatrists like to see people because then they can gauge the interaction between the parent and the patient. They can also get really good history that way. It's hard to get a separate history on telehealth from a person because then they have to stick the kid in the other room. You've got to shift things around. It's just not very feasible to get the histories that you want to get. So we tend to encourage that live. But that's just with child and adolescent psychiatrists. You've got a lot of pediatricians who are probably refilling medicines via telehealth, and probably a lot of primary care doctors also.
You recognize.
One more, thank you, Mr. Chairman. Whenever these drugs are prescribed, is there a pretty at-length conversations about what these drugs can do and the problems, not necessarily whenever the patient may start taking the drug, but I think a lot of the problem is whenever they actually quit taking the drug for some reason is when that's what I've seen.
Yeah,
So
non-compliance
is that really, I mean, is it laid out pretty good for them, know
So
what they're getting
generally-
themselves into?
Yeah, so generally speaking, if you did it, in our office, we do 60 to 90-minute evals on a new patient. So if you took that total time and you figure what part is the actual evaluation, you're probably talking a 60 to 75-minute evaluation. And then the remainder of that time is spent discussing the plan. What are their options? And then what are the risks and the benefits of those options? We don't whip out the entire FDA package insert, because if I did, I'd often have a patient completely discouraged from taking care. I walk through the highlights. The boxed warnings are the first thing that is discussed. And box warnings include, things like weight gain, diabetes, metabolic syndrome, besides things like suicidal ideation.
One more, Mr.
You're
Chairman.
recognized.
Thank you, Mr. Chairman. So up to that point, whenever you have that time that you are explaining that, how many times have you seen that patient before then?
You're recognized.
For a first appointment or for
I'm saying
consistent
whenever
appointments?
you set them down and explain to them the drug and prescribe them the drug, how many times before that have you seen that
So
patient?
from a psychiatrist perspective, it would be the first visit, you would be discussing it, and you might prescribe in the first visit. Often if the patient's too complicated, which happens when you've got chronic conditions or really significant illness, because we are getting the sickest of the sick patients. So sometimes there might be a second visit before we're actually writing a medication. That is not the case with pediatricians, primary care docs, et cetera, because they're much tighter schedules. They frequently get, assessments and histories in a shorter time period.
Thank you, Mr. Chairman.
All right, thank you. Any further questions for this, while we're out of session? All right, seeing none, thank you. And we will go back into session. Representative Lynn, you are recognized.
Thank you, Mr. Chairman. I would like to say that, the doctor said we're kind of already doing this. I have spoken to a lot of people where they didn't have this information, but if we're kind of already doing this, the passage of this bill will make sure that we do this, or it will help to make sure that we do this, because it is very important. And then secondly, the bill does allow for telehealth. So telehealth should be one of the easiest ways that there could be to get the acknowledgement from a patient, because there's, things can pop up. You have the chat section, you have other areas on telehealth where things can be, declared or noted or electronically signed. So telehealth doesn't seem like it would be a difficulty. And as I said, this really is very important. And I hope that we can ensure that this does happen for all patients.
All right, thank you. Any further questions? Chairman Williams.
Thank you, Chairman Lynn, you and I, Chair Lynn and I, we talked about this, and I talked to a couple of your folks last week for a brief stint. The amendment, I think, which is why I made a motion on it, the amendment, I think, dramatically improves the original bill, because the original bill, but flatly, I was a no, and I talked to the folks that came to see me last week in order to do that. I do know that your personal experience also is extremely important to you as it relates to your own family and the communication regarding those. So I think that I really would take into consideration the problems I have still yet with the bill, which I discussed with you earlier, is the whole written consent thing is a big challenge, because as you well know, particularly patients that go to see their healthcare providers, what happens in the event they don't sign or refuse to sign the informed consent, saying that someone read it to them? Does that put the doctor that's liable to do that? They can't force somebody to sign the informed consent language, which would jeopardize that doctor-patient relationship. In addition, it would really cause the doctor then to have to withhold healthcare decisions that they may make based upon the individual part of it, because they refuse to have the informed consent. The other thing that is unclear that I have a challenge with is, as was discussed earlier, which document are we talking about they're going to have to read to them verbally? I mean, is it a 17-page document per pharmaceutical. How are they going to be able to read all that and still provide time for the healthcare and then be able to reach other patients, regardless of whether it's in person or not? There are a lot of things that still have to be discussed. I think one of the other issues is which description of that is the case, and would the physician be responsible if the FDA had a concern as to how those two pharmaceuticals or psychoactive drugs actually relate to one another, and what the byproducts or challenges associated with that would be. I'm not sure. Obviously, I'm relatively certain for those people who came and testified last week that there was detrimental things when the loss of their life or their family was there. But it also has, when we make a law here, it also has to be doable or workable. And right now, I don't see how that could be the case, even in the amended language. And so I have a lot of concerns about it. I think that you're right. It is at a form that's better than it was before, but I don't feel like that I can support it at the current language that's in there. I think that you do have a lot more work to do. Of course, doesn't matter if it's this committee or another committee, moving a bill in order to work on it is a big challenge, and that's really up to the committee whether or not he wants to do that. So I wanted you to know, I wanted you to go on the record. I really understand and am concerned about people being able to know, and then what's the role of the pharmacist when the prescription is filled? Are they going to need to read the entire 17-page background from the FDA on what's going to happen? It just seems as though it's very difficult to do what it is you're trying to do. But I do think it's valiant that you're trying to do it. I'm just not sure this is the right way. But thank you very much.
Thank you. You're recognized.
Thank you very much. And I truly appreciate all of your comments. We do this for some other medications, and in the bill, declination is in the bill. Sometimes patients refuse informed consent, and they can refuse that. And so that is in the bill. So that doesn't seem to be a worry. And I understand what you're saying, that we don't know how long the enclosure might be. But the bill does say the highlight page of the product label, which includes a summary of warnings, cautions, and any black box warning. How long might those highlight pages be? I think, we've all seen the highlights. So, I don't know. But Mr. Chairman, is this the last day of this committee? Is it?
That's the plan.
Well, in the Senate, there is a senator who has one more idea to streamline this bill. If the committee would be so kind, if we could move it to full committee, and if we can't come to that agreement, then we will give up for this year. But if we can come up with something, it definitely would be beneficial for Tennesseans. So I'm totally at the will of the committee, but I truly appreciate your time and your hard work on this bill. And Chairman Williams, thank you so much for thinking through it so well.
All right, thank you. So if there's no further questions, we will put that to the will of the committee. Will the clerk please open up the board for a vote? Will the clerk please take a vote?
Mr. Chairman, you have 3 ayes and 5 nays.
We'll keep working on it. Thank you, Mr. Chairman, and thank you, members of the committee.
House Bill 1160 fails to pass. But that brings us to item number 9, and I don't see Chairman Farmer here. House Bill 1972, we will roll to the hill. Brings us to item number 10, House Bill 2110. Mr. Boyd, you are recognized. And I believe you have an amendment.
Thank you, Mr. Chairman and committee.
You have
I
a
do
motion, a
have
second?
that's amendment drafting code 015684.
015684. Can I get a motion? You have a motion and a second. All those in favor vote aye. Opposed? Ayes have it. We're on the bills submitted. You're recognized.
Thank you, Mr. Chairman. Members, this is brought to me by the Health Facilities Commission. It truly is a cleanup bill. It makes a few minor changes such as expediting data requests for CON applicants. It transfers the duty of designating critical access hospitals from the Department of Health to the Health Facilities Commission, brings the procedures and authority of the Health Facilities Commission in line with other health-related boards. It expands the accrediting bodies of MRI and PET machines to any nationally recognized entity rather than naming a specific organization. There are a few other things, Mr. Chairman and committee, but unless y'all want me to go into more detail, it's a pretty simple cleanup bill.
Okay. Any questions for the sponsor of the bill? All right. Seeing none, we'll be voting on House Bill 2110. All those in favor, clerk, open up the board for the vote. All those in favor vote aye. Opposed, vote no. Clerk, please take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
House Bill 2110 passes and moves on to full health.
Thank you, Chairman and committee.
Thank you. All right, and let's see. We are number 12, House Bill 1991. Chairman Hill, you recognize. And I believe you have an amendment, is that correct?
Yes, Chairman, it's 013.
Oh, can I get a motion second on the bill? Okay, your motion second. Okay. Like I said, this is a team effort today. We're okay, you have an amendment, drafting code.
013563.
Okay.
That's the first one.
All right, that's the first one. 013563. All those in favor say aye. Aye. Opposed? Ayes have it. And you have one that changes the date, is that correct?
That's right, Mr. Chairman, it's 015904.
015904. You have a motion and a second. All those in favor say aye. Aye. Opposed? Ayes have it. Now we're in proper form. You are recognized.
Thank you, Mr. Chairman. House Bill 1991 as amended will align Tennessee code to the reality of how the modern dental offices work, how their work flows, and add some additional items to a dental hygienist prescriptive authority. The legislation has been worked on tirelessly and agreed to by the Tennessee Dental Hygienists Association and the Tennessee Dental Association. I can go section by section if the committee.
Okay. Do we have any questions for the sponsor of the bill? Seeing none, will the clerk please open up the board for the vote? All those in favor vote aye. Opposed, vote no. Clerk, please take the vote.
Mr. Chairman, you have 7 ayes and 0 nays.
House Bill 1991 passes and moves on to full health. And would the attorneys please roll those two amendments into one amendment for full health? All right, that brings us to item number 13, House Bill 2093. Chairman Williams, you are recognized.
Second my own bill there.
Motion second.
The, I do have an amendment drafting code 014393. The
014393.
Yes, sir.
Okay, I need a motion. Motion and a second. Okay, all those in favor say aye.
Aye.
Opposed, ayes have it. Bill's in proper form. You're recognized.
Thank you. This bill, as amended, would prohibit MCOs from including provisions in their contract allowing for the termination of nursing homes without cause. This speaks to the any willing provider clause that was currently in statute. Just to clarify it, it will require TennCare to review and approve all contracts to ensure so no such provisions were inadvertently included. That's what the bill does. I'm happy to answer any questions members might have.
All right. Do we have any questions for the sponsor of the bill? Seeing none, will the clerk please open the board for a vote? All those in favor vote aye. Opposed, vote no. There we go. All right. Will the clerk please take the vote?
Mr. Chairman, you have 7 ayes and 0 nays.
All right. House Bill 2093 passes and moves on to full health. All right. Let's see, that brings us down to item number 18, House Bill 1369.
Motion.
You have a motion and a second, and let me get my act together here. Do you have an amendment?
Yes, I do.
Okay, what is our drafting code we're
That
going
drafting
with?
code is 016074.
016074. That a motion a second? Okay. All those in favor say aye. Aye. Opposed? Ayes have it. We're in proper form. You're recognized.
Thank you, Chairman and Committee. The amendment makes the bill where it requires the Department of Health in collaboration with the Department of Human Services to make available and require educational material on blood lead level testing for pregnant women who receive vouchers for the Special Supplemental Food Program for women, infants, and children. It requires the Department of Health to provide women educational information on specialized nutritional services, education on how to mitigate lead in the body, and other existing wraparound services tailored for people with elevated blood lead level or lead poisoning. With that, I stand by for your consideration.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, will clerk please open up the board? We're going to vote on House Bill 1369. All those in favor vote aye. Opposed vote no. Will clerk please take the vote?
Mr. Chairman, you have 8 ayes and 0 nays.
House Bill 1369 passes and moves on to full health.
Thank you, Chairman and Committee.
All right, thank you. And so, let me take a quick recess. Okay, we are going to take a 2-minute recess without objection. We are back in session. That brings us to, we're in item number 7, House Bill 0684 by Chairman Farmer. You have a motion second, you're recognized. I believe you have an amendment.
Thank you, Mr. Chair. Members, so I was literally presenting, got in the middle of the
I know.
bill I was presenting.
That's
there. Of course,
all right.
I know we've all been there and done that. So looks like it's 14642.
You have a motion second on drafting code 014642. All those in favor say aye. Opposed, ayes have it. Go back to bills amended. You're recognized.
Right, members, Mr. Chair, and thank you for indulging me and waiting on me here. I appreciate it. What this provide for, a couple years ago, I passed a bill that said when inmates leave prison, sometimes been there quite a while, they'll need to have their driver, all the documentation they need to get like their birth certificate, driver's license, so that way they can kind of get started. This will provide that they know have all what they need to have their SNAP benefits given them. So when they get out, they can eat and survive.
Do we have any questions for the sponsor of the bill? And I just want to commend you, for this bill is worth waiting for. It's a good bill.
Thank you.
So,
I appreciate it.
all right. So would the clerk please open up the vote? All those in favor vote aye, opposed vote no. And clerk, please take the vote.
Mr. Chairman, you have 8 ayes and 0 nays.
House Bill 684 passes and moves on to full health. That brings us to item number 9, House Bill 1972. Chairman, you have motion and second. You're recognized. I believe you have an amendment drafting code 015699. Is that correct?
That's correct, Mr. Chair. Thank you.
Your motion and second. All those in favor say aye. Opposed, ayes have it. We're on the bills amended. You're recognized.
Thank you, members. What this bill would do if the federal government were to act on medical marijuana or cannabis, if they were to schedule that from a 1 to a 3 before anything could be done here, we need to approve it. So it gives us, it strictly says, it's basically a trigger bill. If it goes from the Schedule 1 to Schedule 3, it allows this body to make the decisions on how we're going to move forward if we do decide to do anything with medical marijuana.
Okay. Any questions for the sponsor of the bill? All right, seeing none, will clerk please open the vote? All right, will clerk please take the vote?
Mr. Chairman, you have 8 ayes and 0 nays.
All right, House Bill 1972 passes and moves on to full health.
Mr. Chair, committee, thank you so much.
All right, thank you. All right, folks, that brings us to the end of our work. And it's been a pleasure sitting in today. It's a team effort, but we got through it. And so, I appreciate all the work that the staff has done. All those that on this committee does a lot of the hard work and a lot of the lifting that has to be done to keep our state healthy. And I know that Chairman Martin, he wants to make Tennessee healthy again. And so we do the hard work in here and he does a great job. Our attorneys, I can't tell you how much help they have been throughout the year and how much help they continue to be. And our research analysts and our assistants and our clerks, we can't do this without pushing those buttons. And they're the ones that figure out how to do the buttons. And Sergeant Arms, keep us safe and keep us on track. So I'd like to thank everybody for that. So seeing no further business before us, we are adjourned to the call, subject to the call of the chair. Closed, subject to the call of chair.